Dapagliflozin is an antidiabetic drug used to treat type 2 diabetes. Dapagliflozin is a SGLT2 inhibitor, a protein called sodium glucose transporter 2, which is present in the kidney, is get inhibited by the dapagliflozin drugs. This sodium glucose transporter 2 is a protein which is responsible for reabsorption of the sugar in the kidney. So, by inhibiting this protein, so there will reduction in the reabsorption of the sugar from the kidney and there will be more excretion of the sugar. Hence, the patient will get a good control in on his sugar level. The other two drugs which are fall under this category are canagliflozin and empagliflozin. The word glyphosine refers to a category of SGLT2 inhibitors. Gly refers to glucose, flow refers to flow of the sugar, and in refers to the inhibitor. So these are the drugs which falls under this category. One is dapagliflozin, canagliflozin, empagliflozin. These are the few examples for SGLT2 inhibitors. So today we are talking about the dapagliflozin. This is a structural formula of the dapagliflozin. Sodium glucose transporter protein, that is SGLT2, is responsible for at least 90% of the glucose reabsorption in the kidney. So, it's the 90% of the sugar reabsorption which takes place in the kidney is because of the SGLT2. So, by inhibiting this or blocking this transporter mechanism, causes blood glucose to be eliminated through the urine. This is how the dapagliflozin act in the body to control the sugar level. Coming to the dose and administration, the initial starting dose is 5 mg and later it can be increased to 10 mg if required. And administration method is one OD, especially in the morning, because as you know, it forms the glycosuria. Hence, if it is given in the night and all, so chances of getting a urinary tract infection or mycotic infection in the genitalia will increase. Hence, it has to be given in the morning only. People who are already receiving the insulin or the sulfonylureas for his sugar level, and later on, if the dapagliflozin is added, then the chances of getting a good sugar level or hypoglycemia will increase. Hence, they may the requirement of lowering the insulin or sulfonylurea dosage. Patient with renal impairment, renal function test is recommended prior to the initiation of dapagliflozin because it works on the kidney. If the glomerular filtration rate is less than 60 ml per minute per 1.73 meter square body surface area, if it is less than 60 ml per minute urine output or glomerular filtration rate, then dapagliflozin supposed not to be started. Means dapagliflozin is not recommended in the patients with severe renal impairment or uh, disturbed renal function, that is kidney function. Hence, before starting, you have to go for the renal function test. Warning and precautions. See, more amount of the sugar is eliminated through the body, then definitely there will be a lot of fluid also get out of the body. Hence, the hypovolemic hypotension may be result of this. Due to the intravascular volume contraction, the patient may move into hypotension. Impaired renal function, this part we have already discussed. Hypoglycemia, that is decreased blood sugar level because it's eliminating maximum sugar level from the body. And genital mycotic infection and urinary sepsis. Even sometimes we may get the Fournier's gangrene also. People who are receiving the SGLT2 inhibitor for longer duration. So, high sugar level is a favorable condition for the all the microorganisms. In the same way, the fungal infection and urinary sepsis are commonly seen because of the high sugar flow in the urinary tract, so which may lead into mycotic infection or urinary sepsis. We may get the UDKA, diabetic ketoacidosis, because of less sugar. The insulin level will decreases, which increases the glucagon secretion, which promote the shift of the glucose to the fat metabolism and stimulates the ketogenesis. Because of the increased fat metabolism, the sugar level, ketone bodies are generated. This is how the patient's body weight also reduces. See, insulin comes down and glucagon increases, which promote a shift of the glucose to the fat metabolism. And because of fat metabolism, the patient loses the weight. Sometimes, which may result into diabetic ketoacidosis also. This is a diabetic ketoacidosis. Means the sugar will be in normal, but patient move into diabetic ketoacidosis. That is because of the dapagliflozin or other any SGLT2 inhibitors. So longer duration is resulted into the bladder cancer also. So this is about the brief about the dapagliflozin. If you like this video, then kindly press the like button and subscribe to the channel and share to the needed people. Thank you for watching my video.